Bismillahirrahmanirrahim. So thank you everyone for joining us for this webinar from Northwest Clinic. So let's start, and we'll be taking some questions towards the end. So anything that you have, please note them down, and we'll plenty of time to go through some questions and have a brief discussion as well. So we're talking about the management of GI and digestive issues in Ramadan. I'm Afrasyab Khan, consultant gastroenterologist here at Northwest Clinic. I've got a fellowship from the Royal Australasian College of Physicians with training in New Zealand, and I'm a member of their gastroenterology society. I've also got training in endoscopy, both therapeutic as well as diagnostic, and ERCP as well. So talking about fasting and food intake, so the typical eating pattern is usually 3 main meals with some snacks in between. And then there are some other fasting patterns, which are mainly used to improve metabolic profile or improve lipid profile or lose weight. So those fasting patterns include, for example, periodic fasting or time-restricted fasting, and intermittent fasting as well. So intermittent fasting is basically on and off fasting, either alternate days or twice a week, and then there are different variations of that. And Ramadan fasting actually is then different to all of the above. So there's a lot of variation in Ramadan fasting as well, in terms of geographic location, how long the fast is, cultural and social norms in terms of food intake, when to eat, how to eat, what to eat. So Ramadan fasting is actually quite different from these other fasting patterns, which are mainly used for weight loss or improving one's metabolic or lipid profile. And here you can see, for example, at the top end, you can see a normal feeding pattern. Let's say you have a breakfast, snacks, lunch, dinner, and then fasting periods are denoted by the yellow to green arrows. So that's what a normal, usual trend is in terms of normal feeding. Intermittent fasting, again, you have some low-calorie daytime feeding and have some fast in between, and then alternates day to day. Ramadan fasting, as you can see here, is quite different. Here you've got a fast during the daytime, and it's mainly nocturnal feeding. And depending on individual preference, social norms, depending on how one is brought up, what they've been having from Ramadan, for example, when they were a teenager and growing up, then those habits usually continue on into adulthood. And here you can see that the mostly eating and intake during Ramadan is nocturnal feeding, and usually it's high calories, with some variation, of course. And these blue lines here, they represent the glycemic profile, which would be roughly equivalent to, let's say, the average blood sugar levels. And you can see here with Ramadan, they are quite fluctuating, and there's a lot of variability from person to person, depending on what they're eating and how much they're eating. Some people may miss suhoor, which is not advised, and so that will affect glycemic profile, as well as may exacerbate some GI symptoms in certain people as well. So the energy intake, which is advisable, like the how much you should have in suhoor or sehri, as well as iftar and dinner. So who should have at least like 30% of your energy intake for the day, up to 40%. Iftar and dinner, 40 to 50%, and then you some snacks around in between iftar and dinner or around bedtime. It should be maybe 10 to 20%. However, studies have noticed that this is actually not the case in a lot of people. So a lot of people actually have sometimes up to 70, 75%, or even more of the total daily energy intake. They do that around the iftar and dinner time, leaving either missing suhoor or having very minimal energy or nutrient intake early in the morning. So there's quite a lot of variation there in this division, and of course, person to person, day to day as well. And this is what's called the recommended Ramadan plate. So we should aim to have more high fiber, complex carbohydrates. So those will include brown rice, oats, whole grain bread, a lot of lentils and legumes, pasta, fruits. So complex carbohydrates which do not result in a sudden high in blood sugar. In addition to that, complex carbohydrate take a little longer to digest, so you don't feel hungry very quickly after having them. Proteins, again, more prefer that your protein intake comes mostly from peas, some lentils, peanuts, and try that your protein comes from non-red meat sources, so fish and chicken. And then fat intake, mostly try to have unsaturated fats, which are more in vegetables, nuts, and seeds. Patients with known gastrointestinal or liver disease or other chronic diseases, especially diabetes and chronic kidney disease, they should consult their doctor or their specialist for individualized recommendations for Ramadan. Specifically, the first question obviously there would be whether they should fast or not fast, and that will depend on a number of factors that their specialist will be able to help them. And again, if they are fasting, there will be some specific recommendations for them in terms of what to eat, how to eat, etc. So it's important for patients to consult their specialist if they've got a known gastrointestinal or known liver disease, and or diabetes or chronic kidney disease. Now, gastrointestinal symptoms, there are a number of factors that can cause it, and then there are some specific factors that will increase these symptoms specifically during Ramadan because of fasting and because of some alteration in the food we eat. So mostly there are large meals, high fat containing, high carbohydrate meals, missing suhoor. And so these things can result in some GI symptoms. Studies during Ramadan have shown that in general, overall, the gastric acid secretion is increased, as well as pepsin secretion is increased, which is one of the stimulants of gastric acid secretion as well. And that can lead to some GI symptoms, especially people who are more prone to reflux disease. Smoking, of course, can cause a lot of gastrointestinal symptoms even without fasting, but the effect can be exacerbated when in a prolonged fast. Again, inadequate hydration as well can contribute to a lot of gastrointestinal symptoms. This is, of course, more important in hotter climates and people who are not used to having some regular water intake. Water intake, again, hydration should be not just done during iftar. It should be staggered and kind of spread out over the course of the time that one is eating and drinking. And GI symptoms that can occur because of these factors and some other factors as well, which can be individual. For example, some anti-inflammatory medications while one is fasting that can exacerbate some gastrointestinal symptoms as well. So it could be some worsening symptoms of kind of known gastrointestinal disease. Someone who's been diagnosed with, for example, gastroesophageal reflux disease, or have had previous ulcers, or is known to have some gastritis. So, I mean, these symptoms can potentially get worse with all these changes and some additional changes that can occur during Ramadan fasting. And again, these can be managed with preemptive measures to see your specialist, discuss these problems, see if there's any additional medications or new medications they can try, and give you some lifestyle and food intake advice as well. And then there are people who have undiagnosed disease, so we're having the problem, but not significant enough to cause them some issues, or it's not significant enough for them that they need to seek medical care. And during Ramadan, some of these symptoms can become worse and kind of unmask the underlying problem in this. So that obviously happens, and we do see patients with this as well, that they might have some on and off symptoms which they have disregarded or are not severe enough to cause them problems. But then during Ramadan, they start to have some additional symptoms, mainly because of some of these factors. And then looking back or thinking back, they do realize that, yeah, they may be having some symptoms before that as well. Then additionally, there may be some cases with new symptoms, which is usually exacerbation of underlying gastroesophageal reflux disease. In addition to that, people do present with constipation, abdominal discomfort, and bloating, mostly due to all these changes that occur during the period of fasting. And if eating habits are not healthy, then these symptoms and the problems are compounded. And so some of these precipitants of upper gastrointestinal symptoms in Ramadan are quite common and common in a lot of people. And I mean, a combination of these obviously will precipitate quite a number of symptoms. So large fatty meals in a single sitting, usually not advisable. It's better to stagger, like I mentioned before, your calorie and food intake as much as possible. Obviously, because of habits and cultural norms, it can be difficult, but it's recommended that your food nutrient intake should be a bit staggered or spread across the time that you're going to be eating and drinking. Lying down after eating, either on the couch or going straight to bed immediately after dinner, again, it's not advised. Excess of carbonated beverages, especially in patients who are having symptoms or known problems, they should avoid any carbonated beverages. These include also diet sodas as well. Excess caffeine can cause symptoms as well. Things that are better avoided, or at least taken in low quantities, would mainly be fatty and fried foods, citrus food, which include grapefruit juice, oranges, and tomato or other tomato-based products. Smoking, of course, is not advisable. The habit of having iftar and immediately smoking afterwards, or having suhoor and immediately smoking afterwards, this is absolutely not advisable. And Ramadan is a good time to quit smoking. Take the opportunity here. Certain medications, of course, if people are taking certain anti-inflammatory medications, for example, for joint pains or otherwise, they can sometimes exacerbate gastrointestinal symptoms or kind of cause new symptoms, especially with a prolonged fast and an empty stomach. So again, talk to your doctor and see if you need to continue taking these medications. Then they can give you some advice in terms of changes that you can do or add some additional medication for stomach protection. Now, one of the questions that obviously comes up is weight changes or changes in weight during Ramadan. And we have to realize that there's a lot of inter-individual variability, quite a lot. And overall, in studies looking into people not trying to lose weight, but generally the effect of Ramadan, overall, there is modest or no change in weight on average. And this is talking about people who are just fasting, they are not actively trying to lose weight. Again, there are some people who will actually gain weight during Ramadan. Now, that is because of the changes in the routine, lack of exercise, the increase in overall nutrient intake despite the fasting period, increase in carbohydrates, etc. So, and more sedentary periods during Ramadan can result in overall, after 4 weeks, some weight gain actually, regardless of the fasting during the daytime. And a lot of these factors that affect the weight, which can make the weight go up or go down or even stay completely the same, would be obviously individual factors, which include kind of job routine, how often or how soon you are able to break your fast, and if you do, what is your main kind of nutrient intake and your composition of your iftar and dinner, whether someone is missing suhoor or having it, etc. Any exercise that someone was doing before that and not doing during Ramadan can affect things as well. Genetic factors usually non-modifiable there. Again, some social and cultural factors that come into play as well. Somebody sitting around a table in a family having a meal would generally tend to have whatever everyone else is having, which may or may not be very healthy for them on an individual basis. And then some gut microbiome. Everyone has certain alteration in the microbiome of the gut that can affect the weight as well. One thing to note here is that whatever weight loss is noted in Ramadan, and studies may have shown like 0.7 to 1.5 kilos of more modest weight loss, without ongoing diet and lifestyle changes after the month of Ramadan, studies have shown that actually that weight is again regained within 4 to 5 weeks. So within a month after Ramadan, any weight loss that has occurred can be regained, if not in a month or 2 months, if there is no ongoing diet and lifestyle changes in someone who is attempting to lose weight. So that is important to note there. So things to do during this month would be to eat in moderation, small quantities, try and prefer complex carbohydrates, which are slow digesting. This is preferred over simple sugars, of course. And break your fast early as soon as you can. Do not miss sahri or suhoor. When you're eating, try to eat slowly. Avoid large meals in a single setting or in a short period of time. And the hydration, of course, is important. Again, this should be spread over the course of the time that you're allowed to eat and drink. So, question, let's move on to some questions that we have. Okay. Let's see what we have. So a question about the effect of smoking and relation with hydration, or actually overall, smoking is kind of associated with gastritis and peptic ulcer disease. And so this month is a great opportunity to basically quit smoking altogether. Smoking also affects the healing ability of the stomach lining, and it impairs the healing of any previously present ulcers. In addition, smoking can also contribute to kind of recurrence of ulcers. So my advice would be to talk to your doctor about some alternative like nicotine patches or gums to kind of slowly wean off this habit and quit it altogether. Hydration. So I think we've got another question about what foods to eat at suhoor to avoid acid reflux. So a lot of factors there that can cause reflux, and kind of what we eat will only be one of the things that we can do. In general, decreasing reflux would be reducing kind of overall precipitants, and these precipitants of reflux would be avoiding large meals. So if you do suhoor, start a little bit early instead of waiting towards the end, which would mean that you try to eat more in a short period of time. To try not to do that, if try to wake up a bit early and start with suhoor a little bit early, so you have a reasonable amount of time to have a good meal. Again, avoid lying down immediately after eating, so give it some time. Avoid carbonated beverages, coffee and tea only in small quantities, especially if someone is having ongoing reflux. It might be advisable to avoid coffee altogether for a week or so to see if that affects the reflux at all. Food to avoid, I think we went on over in a few slides back, to avoid mainly foods that would increase your stomach acidity. That would include citrus fruits, tomato-based products. If you are still having ongoing reflux, again, obviously spicy and fatty meals tend to worsen it in some people. And so simple foods, complex carbohydrates would be better if you are planning on taking some carbohydrates. Again, overall, if the lifestyle measures are not helping, or you're still having ongoing issues, then the next step obviously will be to excuse me, see your specialist, see a doctor, and talk about the options, talk about medication options. Make sure they go over any red flags that might need some further investigations in case of ongoing reflux, despite management with dietary modification and medications. I hope that answers the question. A question about food and fiber intake. So I think due to the alteration in what we eat during the month, one can be predisposed to dehydration, and if the fiber content is not good, then people are prone to constipation as well. I think in terms of fiber, one can think about fruits that are good sources of fiber. These include kiwi fruit, pears, mangoes, melon, other things like oats, whole grain bread, vegetables including like broccoli and carrots. Pulses are good as well. Peas, beans. Now, all these things with good hydration and a good amount of fiber will prevent any constipation from developing during this month, in which people are prone to dehydration, and with alteration in the food intake that can happen. Now remember, a caveat to all of this is that any new alteration in bowel habit, especially in someone who's over the age of 40 or 45, should not be taken lightly, and you should consult your doctor about that, because sometimes that can be an indication of some underlying problem. So that is important to note here in this case. So, question about fluid or water intake. Okay. So again, that there's a lot of variability there about how much water or fluid one should have, and a lot of factors affect that. Example would be like a 70 kilogram adult would usually need approximately about 3 liters of water a day. Now, remember, it doesn't mean having all of those 3 liter like in glasses of water. The food that we eat also has some water in it. So on average, that would be like 0.8 liter of those 3 liters one can have from food. And then the remainder is usually either some kind of fluid intake there. Now, importantly, also one should drink to thirst. So don't overdo it as well, because the kidneys usually are very sensitive organs, and they will kind of provoke some thirst. So if you need hydration or water intake, you will get the feeling that you are thirsty. So drink to thirst. Don't overdo it again, but just spread out the water or fluid intake over the course of the time that one is allowed to eat and drink. So, tips to lose weight. So, tips to lose weight while fasting would be any advice generally that would be for weight loss, which would mean avoiding simple sugars, fatty food, getting regular exercise, making sure your food intake and fluid intake is healthy. Again, ongoing weight loss will not result just in the month of Ramadan, but mainly with ongoing diet and lifestyle changes. It has to continue. So, like we mentioned before, any weight loss in Ramadan can be regained within a month or two if there's no ongoing diet and lifestyle changes. So there are no simple quick tips there, but it has to be a combination of exercise, diet, and lifestyle changes. Again, getting help from a dietitian would be very helpful in any weight loss program. So that is something that I would advise. So question about stomach having a feeling of fullness and mainly happening after roti or kind of wheat intake, and still some thirst going on. So I think I'll just give a general answer because it may be a little difficult to pinpoint why it's happening in the attendee specific case. But I think overall fullness can result from a number of things. Common things would be having a large meal, for example, fatty meal, or having lots of fried stuff in a single sitting in a short period of time. That can cause problems. Other things that can worsen bloating or fullness would include some underlying gastric issue, for example, a Helicobacter infection, for which it's better to consult with your doctor to see, to screen for that if you are having trouble like that. Specific wheat or kind of roti causing problems, again, could be possibly be related to some gluten sensitivity, and again, that would need to be looked at by some testing by a doctor. Other things would be the general advice that we talked about earlier on about eating slowly, in moderation, spreading your nutrient intake over the course of your time that you are eating and drinking. Additionally, sometimes even reflux disease or can have a variety of symptoms or some dyspeptic symptoms. So talk to your doctor. Sometimes a trial of the medication can help with these things as well. So I hope that answers the question. In terms of still feeling thirsty, it is common, obviously, in this climate, fasting, there will be periods that people will feel thirsty, and you cannot completely, I guess, take that feeling away because it's a normal body's physiologic response that if you don't drink anything in a long period, you will feel thirsty. But the hydration component there is that your intake is kind of averaged, that per day, your total water intake should meet your requirements. So I think that's it there. Okay, I think we've answered all these questions over there. So I think time is there. We've got a few minutes, but I think we've answered all the questions. And yeah, so thank you all for joining us today, and I hope that was an informative session for all of you. Again, important takeaway from here is we can make changes to the way we eat and our routine to ensure that we stay healthy and don't get any or kind of at least decrease the risk of getting some GI symptoms. Importantly, if you're having long-term GI symptoms or any thing you are concerned about, don't take it lightly. Make sure you consult your doctor about anything that's concerning or worrying, and to ensure it's properly investigated, especially if the common conservative measures are not working for you. Um, so thank you for joining us today, and I hope we will keep arranging some ongoing informative sessions for you in future as well.